So I'll talk a bit about current news, because this can be quite a hot topic sometimes in interviews, where there's often, cases which are quite common in the news, which, interviews, this is why we encourage you to sort of read around these topics and sort of read papers and stuff, because it's, it's quite likely that you could get asked about frequent topics. So, for example, there's the impact of Brexit. So this can pose an issue for the NHS, because obviously in Brexit it can have impacts with sort of importing certain drugs, importing, materials and things which are required in the NHS. And then there's also the issue of staffing, because quite a large percentage of the NHS staff come from Europe. So if we then leave the European Union, then there might be an issue if those people have to then leave. There might be an issue with staffing in the NHS, so that then puts pressure on doctors and other healthcare professionals to be able to maintain the quality of care that they should be. There's also Charlie Gard. So he was a young baby with mitochondrial depletion, DNA depletion syndrome. So this is a whole ethical case. So this is looking at the benefits to the child, weighing up against the cost of care and whether it's ethically right to prolong treatment of this child when there's very small chance of recovery. So it's good. It's a really good topic to read around, because it has lots of different ethical cases. So it was sort of the debate between what the parents were wanting for the child, to keep the little boy on life support and to send him over to America to have a consultation and to try some trial treatment, versus what the doctors at Great Ormond Street thought would be best, and that would be to withdraw the child from life support due to there being small chance of survival, etc. So this was taken to court, and there was a big issue around it. But yeah, it's just a really good topic to read up on. And yeah, I recommend to read it. And there's also the issue of the 7-day NHS. So this is something which is slowly trying to be implemented throughout the country. And there are a few providers which are starting to offer Saturday and Sunday services, as well as late night clinics and early morning services. This is again just in a push towards making the NHS 24/7, 7 days a week. And this just brings in an issue for the doctors, because it's longer working hours. Linking in with the junior doctor's contract, the higher rate of pay, the hours in which that will occur will be reduced, so wages will drop, and there's just a whole cascade effect that can occur around a 7-day NHS, such as like burnout of doctors, burnout of staff. Where's funding coming from to provide this service all the time? And again, talking about the junior doctor's contract, so this was an issue sort of in 2015-16, as well. The Secretary of State, Jeremy Hunt, wanted to basically increase the social working hours. Instead of being from 7 a.m. to 7 p.m, he'd then increase them from 7 a.m. to 10 p.m, which meant that the hours, and including Saturdays. So the issue with this is that doctors would then be paid less for working those previously unsocial hours. So again, it's quite complex to sort of talk about in a short video, and it is really good to have a read around. I think Wikipedia is really good at summarising the junior doctor's contract, because there are many different factors that are involved in it, and it does get quite complex. There's also the issue of mental health services. So this is a whole thing for people waiting nearly 2 years to be seen by, quaternary care for their mental health. So it's just, again, a problem. If it's a similar thing with postcode lottery, it's different wherever you go throughout the country. Some people might be seen quite rapidly, whereas others have to wait a long time. And the issue with mental health is for the patient that the needs change over time. So when the person's first referred at the start of the 2 years, they might have completely different needs to what they then have at the end of the 2 years. So the issue becomes a lot more complex, and their needs have changed. And then quite often the problem with that is that they then need to be referred elsewhere, and there's almost always quite another lengthy waiting time for that. So it just has a bigger cascade effect on the patient. And it's also frustrating for the healthcare professionals as well, because they can't do anything about it because it's just an issue of staffing and funding and a whole load of problems. There's also the issue of antibiotic use. So this is something which it's sort of quite recently become a big thing because resistant strains of bacteria are becoming more and more frequent. So again, this is something, and it's just began with the overuse of antibiotics and resistant strains arise, and as we're slowly running out of antibiotics which are being able to treat things, where it's just creating a bigger problem in the long run. So this is something really important to look into, because you could be asked, as future doctors, you're going to have a bigger issue with antibiotic resistance, and you're going to have to be a lot more careful, because at the moment it's an issue, but in so many years down the line it could be a much bigger issue. So as doctors, you've sort of got to gatekeep the antibiotics and really make sure that you've got the right problem solving skills and decision making skills to be able to make correct judgment on antibiotic use and when not you deem them useful. Again, there's also the issue of vaccination. So this has become quite a big thing since the MMR problem. I think it was Andrew Wakefield was a physician which produced a paper, and he'd almost fabricated quite a lot of results. So it was just loads of fabricated information, and a lot of people withdrew from getting their child's vaccinated with the MMR vaccine because he linked it to autism. Although research now has shown that that's debunked, that's not true. So yeah, that's also become a thing with sort of anti-vaxxers and a lot of other vaccinations. People are believing that it's causing all sorts of problems, and when in actual fact they're only trying to do good for the patient. And then there's the postcode lottery. So this is the issue of your postcode determines the sort of what treatments you're able to get access to. So this could be an issue with drugs, sort of maybe cancer treatment. Some patients might have access in some regions, whereas some in other regions don't have access to the same treatment. And it's all sort of to do with funding and sort of the CCGs, and what's been governed for one area might not be the same in another. But that's also a really big issue, because it's sort of, why should someone have their treatment limited depending on where they live? So that can bring up some ethical issues which can be discussed. So again, discussing further on the key issues of the NHS, there's also a good thing, the NHS Constitution. So this sets out some sort of points that the NHS aims to reach. So it's things like providing care for all, and like free at the point of access. There's a good page on, I think it's the Government UK Gov website, that lists out the NHS Constitution. And it's just good just to have it. Don't learn it word for word, but just have the maybe key points in the back of your mind. So if any questions arise, you can say, oh, well, that relates to this point of the NHS Constitution, and if it just shows that you're interested in other things rather than being a doctor. It's because the NHS will most likely be your body of work for the rest of your life. Then there's Harold Shipman. This is an interesting case. This is about a doctor in the 1990s that he worked in a practice in Greater Manchester, and he was found to kill many of his elderly patients using a lethal overdose of morphine. Harold Shipman trained in Leeds, so if you're applying to Leeds, that's something that it could be something that it's mindful to be aware of, because if it's ever brought up, you can say, well, this is what he did wrong, and it's quite close to the area, so it could always be talked about. So yeah, it's just the issue of him sort of exploiting his position of power as a doctor and his trust with patients, and it just brings up that whole issue of patients trusted him because he had sort of this white coat, this halo effect, that patients had so much respect for him because he was their GP and he was a pillar of the community, and they all suspected a thing because he was a doctor. And again, it just brings up the issue of exploiting trust, and you have to be mindful and just aware of these problems, because it's wrong. It should have never happened. It was just a multitude of system failures and misunderstandings that led to him killing so many innocent patients. And again, there's the MMR vaccination and the 2013 measles epidemic. So talking earlier about Dr. Wakefield and the MMR scandal, again, just to read upon, it's really useful. And then resultant of this in 2013, there was a measles epidemic because the decrease in MMR uptake, more children were susceptible to measles, and as a result, there was high rates of infection and issues revolving around that. And there's linking into Harold Shipman, there's also a thing called revalidation. So there's a thing called the 5th Shipman Report and suspension of revalidation and revalidation at last. So revalidation, this was an issue sort of linked in with Harold Shipman. So it was linked to the 5th Shipman Report and suspension of revalidation and then revalidation at last. So revalidation, it could have things such as having appraisals with staff, and again just keeping on top of continuing care and professional development. That's just, again, it's just maintaining patient safety and care and keeping all the medical professionals and doctors up to date with how they're practicing. So there's clinical governance, and clinical governance is the issue of sort of, again, it's a similar thing, it's continuing patient care and sort of improving safety within certain practices and within the health, the healthcare body, the NHS itself. So it's just the whole thing, it's what the NHS takes upon itself to maintain safety and to continually improve itself. Because things within the NHS are constantly changing, so there's always changes in sort of procedures, sort of different medications, different IT systems, and staffing changes all the time. So it's good to have this to sort of keep on top of that and to constantly reform it and to constantly try and improve this. Then there's the audit process. So this is a process where a lot of sort of medical students and junior doctors tend to get involved in. So it's sort of looking at a department or an area or a procedure or something and looking at sort of outcomes from that and what can be improved to better those outcomes and other things which can, sort of help that. That's something quite interesting to read up on because, again, as a medical student, that's something that you might be involved in. So it's also good to have a bit of an idea about the structure of medical training. So roughly this just tends to go from your standard 5 years in medical school, then you've got 2 years of foundation training with FY1 and FY2 years. Following this, you've then got your core training years, so this can be core surgical training or core medical training, and this varies depending on what sort of path you want to go down, and so it's at this point you sort of start to choose and have an idea of your specialty. And then you go on to ST years, so specialist training years. This is when you start to become registrars, and this can last up to 8 years. It just depends on which specialty you want to go into. So again, it can vary from only a few years to again up to about 8 years. So then it's just being mindful of the length of time required to become a consultant or a general practitioner. So this is quite different. Myself, I'm not 100% sure of the exact timings. I know for a consultant it can be about 15, 16 years. Again, it's all dependent on specialty, and if you've got a vague idea of what you want to go into, it might be worth a while just having a look at the exact number of years that are required. And then for a general practitioner, it's sort of after foundation sort of / core training years, you then start to rear off down the general practitioner pathway, which can last about 5 years off the top of my head. So there's also one big issue which is quite recent, and this is the Mid-Staffordshire NHS Trust scandal. So this was sort of brought about by a Healthcare Commission report in 2009, and it's just a set amount of failings that occurred within the Mid-Staffordshire Trust, and it was also sort of staff-related issues. So in 2010 there was the Francis Inquiry, which was an inquiry linked towards this. There are also some cultural issues, and again it was many problems that amounted to these failings occurring within Mid-Staffordshire Trust. There was also the second Francis Inquiry, which was linked to towards this scandal. So again, it was issues with cultural issues with stakeholders. So there was a second Francis inquiry in 2013 which looked further into this issue. So the main issue surrounding sort of the Miss Staffordshire scandal was it just led to a big compromise of patient safety because of many different factors, such as, like, again, as I mentioned, staff-related issues, etc. So there's a model which fits this perfectly, and it'd always be quite good to sort of maybe mention in an interview, and it's called the Swiss cheese model. This is where many different factors contribute to one big error and one big, patient safety breach, and it's good maybe just to read around that, because it's always, even if you're given an ethical scenario or something, or, situational judgment, it's always nice to back things up with models or different things that shows that you've read around the topic and that you have a bit more knowledge than just medical. So again, following on from this,